Well, welcome, everyone. I think we're going to go ahead and get started. Our next speakers we have is Vahid and Shane from Hydreight Technologies. I hope you enjoy. Thank you.
Thank you. Hi, everyone. Thank you so much for attending our presentation. I'll give you a quick rundown about the Hydreight, what Hydreight is, what was the concept behind the Hydreight, where we are. Then I'll pass it to Shane to add some colors on how we are very unique in the market from the technology perspective, from infrastructure perspective that make us very unique. And then we finish the presentation with some numbers, and then any question from you guys we can answer. So Hydreight Technology, the reason and the intention behind creating Hydreight Technology was to taking advantage of the fragmented and the broken healthcare system in the United States. We found a very great opportunity to create the very first and the largest mobile clinical network that has nurses, has doctors, has pharmacies, and also have a way for patients to have access to all the treatments either directly or through a healthcare professional. Now, when you're talking about the United States and 50 states, you're talking about 50 different countries. There are different rules, there are different regulations. We're dealing with 3 different boards: pharmacy board, medical board, and nursing board, that we had to come up with the proper flow of the service, both for patients and business owners and the healthcare professionals, to be fully compliant. We started our mission by tackling the nurse network. In 30 of the 50 states, it's illegal for nurses to work outside of the brick and mortar. Unless they have a medical director, they have access to a doctor network to see the patients before treatments, have access to pharmacies, working under a PC-friendly license and a medical company. So we created them all in a way that the nurses can work as part of our medical company. We created a 50-state medical company with the underlayer technology to define the flow of the service on both sides. Not only we didn't pay the nurses had to pay us a subscription to be part of this network. We created a similar model as Uber. They called us as Uber for nurses because they paid a subscription to come on board with us. Then they had to order from our pharmacy network that there was a margin for us. And then when the service was delivered, we would have taken 10% as a commission on that service. Since 2020, that was the focus. We got it to over 3,000 nurses, and that vertical for us was growing. The second piece of the puzzle, we realized during the COVID, the whole med spa industry in the United States grew really fast. But the reason that grew really fast has 2 different reasons. One was the consumers' behaviors and what they were asking. The second part of it was during the COVID, a lot of the rules and regulation were relaxed. Pandemic over, now they're going after them all. They have to implement all these rules and regulation, that they are not at the capacity of these brick and mortar locations to have a full-time medical director, to have a full doctor network to be able to see the patient 5 minutes before every practice. So we went back and start tweaking our technology and infrastructure to white label to the franchises. So we put the risk in. They still would have been on our platform. They would have used our pharmacies, and basically was hands off for them for running the business operationally in the medical field. But we mandated them to order to our pharmacy. That was the second piece of the puzzle. So we focus on that. Those two areas helped us to get our revenue from roughly about a few $100,000 in end of 2020 to north of 16 million in 2023. Our projection for last year, which we're going to file next week, was over 21 million. That the company did really well quarter by quarter. We walked into the 2024 with 3 goals: make the company profitable, continue the same 30% plus growth, and get attention from the capital market because we went public in 2022, late 2022. And third, creating the most important piece of the puzzle, which is creating a direct-to-the-consumer model that we're not competing with Roman or Hims and Her, but we're creating a market for other businesses to be able to compete with them, because it's almost impossible for them to have a full compliance service over 50 states. We created a technology with the framework of the legal and medical direction and all, that the businesses would get a widget from us. They put on their website. The moment that the lead converts into the patients, everything will be done on our platform without even knowing it. They answer questions. If they need to see a doctor, within 5 minutes, see the doctors. Order goes through. Reassessments will be booked for the following month or the following week, depending on the policy and procedures. And the business will get the money, but everything is going to be done on our side. That was the third piece of the puzzle, that in 2024, we invested a lot of money, a lot of time to get the VSDH1 into the market. Now, we successfully took it to the market. We're going to talk about some numbers. We feel the company is going to continue having that 30-40% growth year over year. We were recognized as the 9th fastest growing company in Canada, 56 in North America by Deloitte last year, 13th fastest growing company in USA with Financial Times, and top venture 50 by TSX. We will continue the same growth with the first two verticals, but the third vertical, we believe, is going to overshadow the growth of the first two. We'll talk more about the numbers and what we do, but I'd like to pass it to Shane Madden, the CEO of the Hydreight, to talk more about how unique our infrastructure and what we have created it for across the board for all these healthcare professionals to start offering their services.
Thank you, Vahid. Hello, everybody. That was wonderful. So I'm going to talk a little bit more about the US healthcare system as a whole. So I think it's going to be easier to tie the unique position we've put Hydreight Technologies in the market. So the US healthcare system is a $4.9 trillion a year spend. 90% of that is technically on what's called technically called preventing chronic conditions. So 90% of the $4 million is technically preventative. So that's across from diabetes to obesity to healthcare decisions, lifestyle decisions. So those types of things. So 2018 is when we formed the company. Now, obviously, everybody knows what happened in 2020, 2021 that shone a light on this, but we were actually looking at what direction was healthcare going to go to actually solve these problems. So the healthcare system was having, incredible problems because of the reactive nature of it. So somebody got sick, somebody went to the physician, somebody went to the hospital, and vice versa. So there was not much ability to do preventative medicine. There was not much look at it. During COVID, these things got, shone a light on, but these problems existed. So there was 3 areas of the healthcare system that we knew this was going to go. So the vision of Hydreight in 2018, which in Q4 of 2024, we feel we completed at least our vision on the 3 verticals, was mobile health and wellness. So that is a mobile health and wellness service being done in a non-traditional setting like a bricks and mortar. So being done in a remote setting at your home, at your office, by a healthcare professional. So we were the first company in the United States to actually allow nurses to monetize their credentials. So what I mean by that is they could become independent contractors using their healthcare license on our structure. Now, so to do this, we had to create a 50-state medical company. So we, at our core, sure, we have custom tech for each vertical that I'll go through, but at our core, we're a 50-state medical company. So our first flagship product, our first vertical that we went after was the nurses. We're still the first movers. We have approximately 3,000 nurses working as independent contractors of our overall medical company. Solved lots of barriers to entry, as Vahid kind of went into there, from medical direction to compliance, which I'll get to in a second, to pharmacy procurement and compliance, all the way through to legal. So We have about 3,000. There's 4.6 million RNs in the United States. So lots of opportunity still there. The second vertical, which was our bricks and mortar vertical, is essentially the non-traditional doctor's office. So we solved a lot of problems for health and wellness facilities that weren't your traditional doctor's office, right? So health and wellness spas, med spas, IV therapy, anybody who's doing a true medical service, but is in your traditional doctor's office. And the third vertical is the direct to consumer. Now, that has been obviously glamorized by the GLP-1 craze and other things like that. But that has been around for a long time. That need has been there. So we're the first company that has actually took these three areas of medicine that are the three areas that this can go into from the 4.9 trillion, which is estimated to be 7.1 by 2030. And we put an infrastructure around this. So just to give you a real world example, everybody here could go home to their hotel room or wherever they're staying and book a nurse to come to their room for a medical treatment on our platform. You can also go to the Cosmopolitan and go into Revive, for example, who would be one of our customers, one of our partners on our network, and you could get a bricks and mortar treatment. Or you could go to one of our partners on VSDH1 and essentially have a direct to consumer telemedicine visit and a product sent to you. So the three areas that healthcare can go, we have set a platform. Now, it obviously takes time to get there. That's why I said Q4 of 2024 was essentially the finalization of the third vertical. That third vertical is obviously incredibly attractive because of its scalability. What I mean by that is that's like Shopify for healthcare. So we didn't just turn around and leverage our platform to be another runner in the field and a competitor of a Hims or a Roman. We actually created a platform that created a safe harbor for these businesses to be able to just market their product. So when I say product, their brand, right? We are the telemedicine company. We are the medical company behind it all, that we allow these businesses to get into this space without liability, without becoming an expert in corporate practice of medicine, without all of these things. So the underlying structure here is that this is not a nice to have. This is a must have. Corporate practice of medicine is exactly what it sounds like. It's the prevention of corporations getting into the practice of medicine in 30 of the 50 states. So unless you have a structure like we have, which takes a long time to get there, takes a lot of research, takes a lot of money, takes a lot of effort, unless you have a structure like that, you are too far behind the game to actually become a competitor in that space. So 3 verticals, 3 very different offerings for 3 very different areas of the healthcare industry. Custom tech. All barriers to entry have been removed. So whether you're a nurse as it wants to improve their life, monetize their credential, whether you're a bricks and mortar that is not a physician's doctor, again, we could solve that too, but wants to help in one of many areas or all areas, from tech to pharmacy procurement to doctor network to compliance. Any of those areas, we have all bricks and mortars that do that. So we have hundreds of bricks and mortars, thousands of nurses, and we have sold, which we'll go into in a second, we've sold 300 to 400 licenses, over 400, I believe, at this point, on our VSDH1 platform. So again, I gave you 2 examples. The third example, just to kind of showcase the strength of the VSDH1 platform, is our direct-to-consumer. Recently, we just partnered with a company called Dr. Frank's. So Dr. Franklin Joseph was one of the doctors that was originally involved in writing the white papers for Eli Lilly and Novo Nordisk. So 15 years ago, 16 years ago, was actually involved in the writing of the patent white papers for those products. Now, that company has been in the UK, other countries, doing GLP-1s, all of that. They partnered with us because US is so difficult. So why not just cut the head off the snake and work with somebody who has it figured out? So from a validation perspective on that vertical, it doesn't get much bigger than that. They've done, $50 to $100 million in global sales in this specific space. The medical director is an expert in that space, and we go from there. So across the 3 verticals, obviously, we're going to continue to organically grow across our first 2. We've gone from $0 to, if Q4 is the same as Q3, be approximately 23 million next year. And that's not considering our third vertical. So just going to pause there and talk about some numbers.
Thanks, Shane. So, as I mentioned earlier, we had our organic growth year over year. This is not a story that we're just projecting for next year or the year after. This is something that we've been doing this since 2020. Our top line and GAAP revenue both has been increasing by between 30 to 40% minimum year over year. And if you look at the revenue that we had from our 2020 to estimated for 2024, and the reason we're using 2024 estimation because it will be filed by next week for our year end. But we walked into 2024 as one of our goals to be go over 21 million revenue top line for 2024. Now, if you consider that our Q4 to be exactly like Q3, which usually like we have quarter over quarter growth, we're going to be over 23 million, between 22 to 23 million for 2024. And with the first two verticals, we're expecting to see the same growth, in 2025 as well. But again, this is only for the first two verticals, not the third one. And as I said, this is not a projection that is based on assumptions. This is a projection that comes based on the historical data that we've had. Now, when you look at our orders from the brick and mortars that Shane mentioned, like for example in Vegas, Cosmopolitan, you can go. That's one of our the white labels that is using us. The pharmacy orders, the number of the orders, and also the number of the locations that they're coming on board with us had the same growth path as well, quarter over quarter. Again, these graphs are historical data, it's not futuristics. So we're very confident that we're going to continue with the same growth pace for the first two verticals. That is just going to put us another 30-40% growth for 2025. Now, our story gets even more interesting when we're talking about the third vertical, which is direct to the consumer. So we approached the direct to consumer from two different angles to have some sort of estimation of what we should expect as our goal that is coming through this. One was we're looking at the number of the licenses that the businesses would come and they bring their orders or they will start marketing. So our goal is by end of 2025, end of December, we get to 1,000 licenses sold. As Shane mentioned, we're on north of 400 already that's been sold, and we're onboarding more and more. Some of them come with a few different licenses, some individual licenses, some handful of licenses. Now, we also came up with two different approaches to have some guesstimation for the number of the orders that we're expecting to see on the VSDH1. We looked at the businesses that are new, and we look at the market, how many orders they can get per week. And all these orders on medications has to be repeated. So it's kind of like a recurring membership. If somebody get on, a hair loss product, on GLP-1 product, they have to continue ordering it month after month and see the results within the 6 months. If they go off this medication, they're going to start seeing the impact is going away. So on the market, they say they're going to be on the same medication at least for 8 to 10 months, depending on the medication. And the second group are the businesses that are coming on board with us, and they're already selling it. They just don't have a proper end-to-end system for full compliance or go to other states. They want something all in. So those are the easier one for us to have a projections with. Our conservative numbers that we think we're going to end up the year with is about 1.3 million orders. We're going to see a jump in Q3 and Q4 because onboarding them has some complexity. Some of these patients are coming on board that we have to make sure we pass them from one medical direction to the other medical direction. Some of them in 4 states, they're dealing with 4 different companies for that. They're coming into one. The renewal for medications, how are the dosages, all that has to come over. All our partners is going to be legislatively approved that it takes about 4 weeks to 6 weeks to get approval for them. But because our platform is legislatively approved, they're all going to get legislative approval. So the average order is anywhere between $80 to $200 depending on medication. We're at 40 plus medication on VSDH1, and we keep adding to it. Like we just had one a few weeks ago was a sublingual GLP-1. Now, if the FDA is cutting the shortage, so the patent coming in place, sublingual still, it won't be impacted. Now, we're focusing a lot on genetic tests and all that for people to be able to get everything at home, see what's going on, and based on that, they can start offering more orders. So on the third vertical by itself, our goal is to get to over the north of 1.3 million. The facts that we see right now, we haven't seen any facts that it contradict with these projections. The majority of the volume we'll see is going to come in the second, third, and fourth quarter, with some indication in Q2 and Q1. Now, again, I need to emphasize that we still going to get to our 30-40% with the first two verticals. Lastly, because not much time, we went public in December 2022. Very tight structure, about 40 million outstanding shares, about 27.5 million in the hand of the Victory Square technology that is vested over 3 years. The company didn't get any loan, any debt, any raise. In the last 3 years, it financed itself for the growth. We both coming from the private sector minded running the company, which is usually profitability, not raise to raise. Earlier this year, with the help of Beacon, we closed the financing, oversubscribed financing, about the $5 million at $1.55. That is still, that already within the first 8 weeks, the investors are up on the money that they put in. That money is gonna go solely on the growth that we can either acquire or invest in the business that they already have part of this 1.3 million orders to bring them to our platform, and we finance their marketing that they have to pay us back. So we help them to bring everything to us. So that 5 million is going to go only on growth, infrastructure, and not under operation, because the business has been EBITDA cash flow positive, adjusted EBITDA positive since Q2 last year. By just taking out the non-cash payments, we issued shares for the team that has been with us for over 3 years, and they put their heart and soul and blood and sweat into this business to get there. So that's a very quick summary about Hydreight. We have a booth if there is any questions. I know we have 3 minutes left. If there is last-minute question, we'll be more than happy to answer. Otherwise, please find us at the hall, and we'll be more than happy to answer your questions. Yes, sir. So the nurses platform side, since I think a year and a half ago, 2 years ago, we sponsored an event in front of the White House for Nurse March. And since then, our sales team has been booked 5 weeks in advance for the demos with the nurses. So we're almost spending close to maybe like $2,000-3,000 on the marketing side on that, just for nurturing side of it. It's kind of is already in the automation mode with the nurturing and all that. On the brick and mortars, we're going after franchises. We have some individuals coming to us, but our outbound is toward the franchises. We sign one franchise, few hundred locations, 80 locations. We rather to get into the franchise agreement. One of our franchises, we are in the franchise agreement. They sold over 700 locations, and they only open about 150. So we know the fact the other 550 is coming in the next 12 months because they're opening up, but we are as part of the franchise agreement. So that part is also the most costly part will be on the direct to consumer, and we decided to, instead of us spending on that, we invest or finance the clients who already getting customers on that, already have orders. So we give you $200,000 if you bring entire volume for us. You pay us back per lead that is coming back, extra dollar per order that is coming back to us. So we're financing their marketing because they already found the formula. They already have businesses. We have businesses we're talking to. They have the orders between 2 to 10 million orders a month that they already processing on their system. So the onboarding them, it takes time. They would love to have financing on their marketing. They already figure out the marketing for every dollar that they put in, how many dollars they're going to take. So I don't know if I answered your question, but it's just kind of like a breakdown between the three on the market side. Yes, ma'am.
No. So they are most for the nurses is essentially they're independent contractors of a medical entity. So it's just like they're working at the hospital, but they're doing it remotely. And so essentially we were the first company to set up a structure like that for 50K. And it kind of ties into your original question, which is the moat is so high, the moat's compliant. It's either do this through a structure like ours, or it's really, it's not kind of a middle ground. And it's the same with the businesses. So if I go back over the three verticals again, the nurses, again, independent contractors of a medical company, cannot be done any other way. The third vertical, which is VSDH1, one of the reasons it's so attractive and so scalable is because not only are we allowing businesses to focus on their brand, their marketing dollars, but it's our medical company. So perfect marriage there. You don't have to worry about liability, doctor network, insurance, becoming an expert in corporate practice medicine. We do all that. They focus on their brand.
There is a radius around when they sign up.
Yeah. So there's an onboarding process. The license, you need to be licensed to operate in the state that you're in. For sure. So if a nurse has multiple licenses, absolutely, she can operate in multiple areas. Obviously, it works through technology, so that has to be set up accordingly. We call it areas of operation, because when the person books, they have to know EPA, similar to an Uber, because it is a service. But essentially, yeah, so the onboarding takes care of where their license is, what are they allowed to do, because again, they're not operating independently. They're independent contractors of a medical team.
Yeah, but the flow will be different. The reason that we need to know the area is they're gonna deal with different doctor network based on the medications. The flow might be different. The way that they do aesthetic in California is different than Vegas. So a part of the onboarding based on their license, we have to set them up as an area of the operation, and everything is gonna be based on that, depending on where the patient is asking for the service.
Thank you, guys. Thank you.
Thank you so much.
Thank you.
Sorry, sir, I didn't catch up. Good, how are you? That's virtually.